Hi everyone, I know we are at 3 o'clock, but we have quite a few participants signed up for today, so we're gonna let everybody roll in until 3:01. Okay, it is 3:01 on the dot, so let's get started because we have a lot of important things to talk about, and we will let everyone else catch up. Good afternoon. Welcome to the National Center for Victims of Crime, Crime Victims Community in COVID-19 webinar. I'm Renee Williams, the Executive Director at NCVC, and I'm delighted to welcome you to today's webinar, Changing the Face of Victim Services in Indian Country. Before I turn this over to our presenters, we have a few quick housekeeping items. We have a lot of people signed up and still a lot of people rolling in. Webinars like these can get a little unwieldy with these types of big numbers, so we have a couple of requests for you. First, we're going to leave the chat function open for everyone, and you access the chat function by clicking on participants. If you hover over the bottom of your Zoom screen, that will be open so you can talk amongst yourselves, introduce yourselves, and have general conversation. We won't be monitoring that chat function closely at all. So what we are going to do is ask that any questions that you would like to be presented to our panelists, that you use the Q&A function. The Q&A function you can also find by hovering right at the bottom of your Zoom screen. There are two thought bubbles and they say Q&A. Those we will be monitoring. For the sake of time, we are going to hold your questions until the very end of the presentation. What always comes up, we do not provide course completion certificates, but you will receive an attendance email. In addition, this will be recorded and it will be made available on our YouTube page and on our website, and we can provide the slides as well. With all of that, I am extremely proud to introduce members of our own team at NCVC, beginning with Gail Tom. Gail is the National Center for Victims of Crime's Project Director of Tribal Resource Tool. I thought it was a lot to get out my title, but that is Gail, and she is an independent consultant on training and technical assistance for the Office for Victims of Crime. She retired from the FBI after 10 years as a victim specialist, spending a good deal of time in South Dakota, working with tribal lands and in the AIAN communities. Gail's extensive career in victim services includes stops in Canada, Alaska, and on the Mexican border. She spent a month in New York City assisting victims of 9/11 and their families at Ground Zero and helped rescue and recovery workers. She's also spent time in New Orleans after Hurricane Katrina, also providing victim assistance to countless people. In 2006, Gail received the highest award for an FBI employee, which is the Director's Award for Excellence, for her team's response to the Red Lake school shootings in Minnesota. We are so lucky to have her on our team, even more lucky to have her presenting today. And with that, I will turn it over to Gail.
Thank you, Renee. It's an honor to get to be here this afternoon, and it's really cool to see all of the different locations rolling in the chat box. We welcome each of you and hope that the information that we share is helpful to you in some way. as Renee shared, my career has been in criminal justice, in law enforcement and victim services. And I was privileged for 10 years to respond to our tribal communities on a daily basis here in South Dakota. I was also on a couple of our national teams, our rapid deployment team and our evidence response team, and consequently got to work with many tribal communities and nations across the country. And that was a great privilege to be able to serve in that way. I am, as Renee said, currently the project director for the Tribal Resource Tool, and we're very excited about that and hope that each of you will make it a point to get online and take a look at tribalresourcetool.org. And Renee's going to tell you more about that. And Renee, would you like to introduce yourself, Renee Bork?
Sure. Hello, good afternoon, and TGIF to everybody. I appreciate you letting us take up some of your Friday afternoon. My name is Renee Bork. I'm a citizen of the Muskogee Creek Nation of Oklahoma. I've spent all of my 16 years of grown-up career of victim services in Indian country. I've been privileged to serve on so many different reservations, to include my own homelands in Oklahoma. I've been privileged to serve in many different capacities, as a tribal advocate, as a sworn police officer in Oklahoma, a federal victim specialist for the BIA, and as a project manager, program manager. That's the worst part about this, is talking about your own self. My experiences with the extreme differences and the very sacred similarities that we have as Indigenous people, I feel like that gives me a platform that I can bring those experiences to any training that we present on. And anybody that knows me knows that one of the things that I preach continually is about not cookie cutting Indian country. There's always an issue with data, funding streams, and Indian country historically is always expected to do more with less, right? So when we lump this all into one category, I just always like to put a little disclaimer out there that what I speak about is based off my own experience with my sister warriors in the field who I work alongside with, and it's not reflective of all of Indian country. Currently, my position now is the program manager for the Tribal Resource Tool. This is an OVC Vision 21 funded project. Did you want me to go on to that part, Gail?
That'd be awesome, please.
Okay. And this project is funded to provide resources to American Indian, Alaska Native victims and survivors of crime, with the click of an online search from a computer, laptop, cell phone. There are several ways you can search on the website, is by location, crime type, services. I'm very passionate about this project because, as I mentioned, working across so many different areas of Indian country, I wished I would have had an online resource to assist me in finding services for victims in areas in which I was unfamiliar, or when victims were unable to access services in their respective communities for numerous reasons. You know, sometimes out of fear. We all know that confidentiality issues are huge in Indian country. We know that's a huge barrier. Sometimes there aren't programs, or we have programs that come in, and when the funding leaves, the program leaves. They just vanish, and that leaves victims without any services. So we had a brilliant group of stakeholders assist in the development of the criteria for inclusion on the program, for promotion, and presenting. So luckily we have some partners that have been involved since the inception of the program to keep that piece going. Our partners that we have on the project is the National Congress of American Indians, and they assist with the promotion, presentation, but most importantly, the gaps analysis report. This data is going to be so helpful to all service providers who serve our American Indian, Alaska Native victims. It's just going to give a really broad picture of missing data, of where we need more services, where we might have services we didn't know we had before, and so forth. So we're really excited about that part of the project. The Tribal Law and Policy Institute, they are also a partner, and they assist with inclusion and promotion. Most importantly, Miss Bonnie Claremont, who has been with the project since its inception. So her continued valued input and the historical knowledge of all the meetings and the discussion keeps us on track with the overall mission. Strong Hearts Native Helpline provided assistance in the population of the tool. And for those programs that are in the tribal resource tool, which provide domestic and sexual violence services, that information is shared in order to expand the information and outreach efforts for victims. Our team is committed and dedicated to ensuring that we have resources for our victims regardless of the geographical location. As a Muskogee residing on the Fort Berthold Indian Reservation, I can personally see how this would benefit me if I was in need of assistance. And all I had to do was jump online and find a resource that I might need where I'm at now if I didn't know anybody here. And our contact information will be made available to you at the end, but if you just jump on tribalresourcetool.org and take a look around, see if you would qualify for inclusion, or if you have questions or you need assistance getting in the program, reach out to me directly and I'll be more than happy to help you.
Thank you, Renee. That's awesome. We're very privileged also to have Lindsay Compton with us from the Rosebud in South Dakota this afternoon. Lindsay, would you like to introduce yourself?
Sure, good afternoon. Are you able to hear me first off?
Yes.
Okay, great. Really honored to be here and thank you for that, and very excited with the momentum of the coming summer season and taking advantage of the opportunity, really trying to look deeper within the opportunities that these challenging times take and the collaborations that are coming out of it, truly. So to introduce myself, I'd like to hold space and be able to do my traditional introduction. So seeing everybody, over 200 participants, and from all nations, east to west coast, all directions, really. It's really powerful and I really appreciate it. So I'm gonna introduce myself in our language as I'm trying to reclaim it and revitalize myself, which I know a lot of efforts are. Lindsay Compton, Crazyable, Imachapi, na la kochaje, Ishna Ewia, na si chanku, makoche mataha eash, ojijinka makoche, otoahe mataha, na inawa eki, Marty Jones, Echapi, na atewa eki, Harold Compton, Crazyable, Echap, na wana, Pate Sanwi o Mashke Kiche, Executive Director, Wana Owawashi Achano. So good afternoon, my friends and relatives. It's such a beautiful day. My name is Lindsay Compton and I'm from the community of Rosebud, South Dakota in the beautiful 605. I hope all of you or whoever's listening and out there and participating that you're able, if you haven't been here already, that you're able to come here and experience good and beauty whenever you come this direction or anywhere. So I'm coming at you from a Plains perspective. And my Lakota name is Woman Who Stands Alone. And I'm from the community of Rosebud. My mom's Marty Jones and my dad's Harold Compton. So, and right now currently I'm the executive director at this beautiful pillar of the community and historical presence of White Buffalo Calf Women's Society, which we're entering our 42nd year here. So we have direct services for our clients or our victims, or the second largest victims awarded victim service provider in the state. We mainly are known for our DV and our SA and our shelter. So historically that came from the matriarchs and it's grown to what it is today. And so we do have a shelter here on site that prior to COVID, we operated at about 90% capacity throughout the year, 100% during certain seasons. And in addition to that, our administration is here and we have different programming aspects that are not able to provide education, that we're able to go into the different justice systems, We have a new Healing to Wellness program that we're really proud of. But beyond that, which we can get into the programmatic aspect later, I'm really thankful to be here, and I was able to connect with Gail the other day through one of those weekly check-in calls from the coalition that we're part of in South Dakota. And so I'm very honored and happy and proud, and I hope that somebody in the Indian world, like it kind of gets smaller every day, like we're one Indian away the more days that go by. And so I love that aspect of it. And I'm really excited that this platform, with all directions being represented, that we're gonna have conversations from the different perspectives now, especially at this time. So thank you for letting me be here today, and I'm excited.
Thank you, Lindsay. One of the things that we're doing here in South Dakota that Lindsay referred to kind of help us all through the COVID-19 times and through the unrest in our world today is having weekly check-in calls with our coalition and network here and with our South Dakota Victim Services. And Lindsay shared a little bit with us last week some cultural considerations that I thought would be wonderful to share on the call. We are pleased to have the opportunity weekly for all of our victim service programs. We sometimes have 40 to 60 different programs on these calls on Monday mornings, and it's a great opportunity to learn from each other and share. And we always talk about resiliency and self-care every week and try to remind each other that it's so important to take care of ourselves during these more trying times. As Renee mentioned, we all have learned to do more with less. And in Indian country, we're especially used to being underfunded and under-resourced. And so we're really trying to maximize all of the different resources that we have. And I thought at the time, especially each week, but especially this last Monday, we look at not only our challenges, but we also try to identify the positives that are coming from the current situation, the changes that we would like to see as outcomes, and what role each of us might play in that process in success of our outcomes. So Lindsay, if you would like, I would like to start out asking you, I know you mentioned White Buffalo Kip is 42 years old, and it's my understanding that White Buffalo Kip was the first sexual assault and domestic violence program that was funded in Indian country. So that's the oldest program that there is. I know as an FBI victim specialist years ago, I got to help implement the first sexual assault response team and the child assessment center there on the Rosebud. And as you said, the program has developed so much since then, but you've had to make some changes over these last few months in service delivery. Would you want to talk to us a little bit about that and anything else that you'd like to share with us?
Absolutely. So March was, it's June, right? No, just kidding. So in March, about mid-March, we had the notification of the pandemic, and immediately our first instinct, I think, as women right away, like what can we do to protect? My first instinct, what can we do to protect and take this very seriously? Traditional narratives, thinking about how pandemics and flus and sicknesses came through, there was no movement at the camp, right? The less movement, the better at the camp. And so that really resonated and applies still today, I believe, right away. So coming at that perspective, ourselves and our board took action and to prioritize our advocates with their safety first and their wellness first, because as many of you know, and many of us advocates who are out there, we're drawn to this work for a reason. Often we've experienced it ourselves. And so advocates really when we work in these organizations and the work that we do, they have such a powerful role oftentimes, you know, at White Buffalo CAF, we don't require any degree, good or bad, whatever that looks like for a piece of paper for our advocates. We really want community members. We want women who have experienced it. We want women, they're driven by their hearts. They're driven by their hearts to this work. And so first priority is to protect our team, right? And so thinking of that and putting into place immediate measures to provide admin leave along with the our guidelines and instructions and creating policy that got board and signed off and everything like that. So made a move on that right away, and really looking at what our intake process looked like once our advocates were safe. We had the shelter well prepared. We had our programming services well prepared. If we had to be offsite and evacuate, maybe our clients or the victims, at White Buffalo CAF, we refer to them as relatives. And so that's been an ongoing thing, I'm sure, since its inception. And so our relatives, preparing the shelter and the space if they needed to hunker down, you know, this is unprecedented. And so I was really happy with our team of amazing staff and advocates that came together and took us very serious, first and foremost. And so for our services, so we have in and out of shelter, then we have our programming services in the schools, in the adult corrections, in the juvenile corrections, different trainings that we're working on developing for the different tribal programs in the community. White Buffalo CAF is a nonprofit, it is not a tribal program. We're a tribally chartered entity. So we have a lot of unique space and sovereignty in how we want to govern ourselves and what that looks like. So it's very unique for this space where we're at and for our service area. Our clients and relatives, and with our weekly calls, I kind of noticed that across the state, maybe in more rural areas, that there was less seeking out the direct services, because as we all know, we have these discussions every day with our team, what it looks like it's already hard enough for women to come forward, victims to come forward, men to come forward, families to come forward. We do have a male SA, sexual assault response advocate, which was new from the state last year, which we're so thankful for, we want to hold on to. So whatever gender or whatever you recognize, and serving all demographics, the direct service kind of went down, which is pretty unusual, because as I said, we operate at a pretty much 90% capacity throughout the year. There are some times, as we all know what that looks like, you can turn around as far as in shelter work. So what does that look like now? We're doing, or the planning that we're doing, and what we have going on and what we look forward to with getting services to our community. And time again, I've heard elders say, Kaka Albert Whitehat would talk about turn back to your tioshpe, turn back to your kinship, turn back to your family, turn back to the land. Over and over and over, when we do those studies in our communities and identify what needs and resources that we want our children to have, that we want our families to have, we want them to be able to have sustainability and independence to be, to provide for themselves, whether it's off the land or whether it's with a skill or service that they can provide. So in the current times, what's being exposed is actually can turn us inward to that healing in those systems. We know there's still victims out there, though. We know there's still trauma and violence going on. And so how do we connect to that and provide service? And so one thing that we've been discussing as a team, and hopefully coming forward with some projects and some proposals and all that fun stuff, is having service sites in the community. I know previously when we talked about 42 years with White Buffalo CAF, there's some historical documents that are tied to it. And one of the things we did run into is they did have a service unit way out over towards Ideal, probably the very eastern corner of our reservation. And so there was like a site there for an advocate. And so we're thinking about splitting up, because in Rosebud and Oglala and a lot of our nations, we have a huge land base and to cover that. And so what does that look like? Whether if the ladies aren't coming to us, if the families aren't coming to us, where can we go? Potentially, again, those different tiny houses and the community buildings. And even right now, putting in for vehicles and funding applications that we're applying to have a mobile unit with telehealth and all the new fun stuff that's coming out with that. But always modeling the social distancing, always providing masks, always getting those direct EFAs at the same time. So having our SPFs and our document and our data is ready to go with our advocates out there as they provide those services. And in this time at home where we had administrators leave or, you know, at home PD and telework, which I'm sure many of us are doing even right now as we're participating in this, developing our team at lightning speed, almost like all the stuff that we wanted to do, Gail and Reen, all the stuff that we wanted to do, like it's here and it's now, and that's powerful. And all of us are experiencing that collectively at once. And so there's definitely an energy in the air. We know that the work that we do has a spiritual tie to it. It truly does. It truly does. And so when we talk about self-care and those things to protect yourself, what does that look like for staff? What does it look like for the clients that we serve? I had a conversation right before this with the team leaders out in the conference room right outside my office. And we spoke about how we can provide better service, not only in our safety and our intake and identifying different things that might be a red flag, trying to work with IHS to actually, because they're both we were HIPAA compliant, to get maybe new advocate or new relatives processed through there, all sorts of stuff that might take a lot of time with those systems, but now it might come together right like that, you know. So that's very exciting. I'd like to touch on maybe some of the cultural services that we are beginning to develop again now that we're having staggered shifts back on site, staggering our advocates, because it's not an 8 to 5 anymore. It's not a 9 to 5. And funny how it works out, that almost can be, how do we use that for our benefit? How can we live in our, you know, our native liberties and enact them right now in a modern time, be a modern day Indigenous woman society with these systems, and how do we change? How does that change the organization and the structure and how we implement moving forward, which is very exciting stuff. So our advocates are staggered here on shift. We're developing different ways that are appropriate for cultural protocol. This morning, we had visited with our DVPI programming, our manager over in Sioux Falls, and talking about what we were going to be reporting on for this quarter, and talking about implementing a cultural, like an intake, our assessment, where are your needs at culturally, where we have a space that's safe, that we can azalea, smudge, that we can provide water or some sort of fruit whenever they come in, because that's medicine too. And how do we prepare those things for that space? That's a whole part of it too. We know we got to go to the store and pick stuff up, but then once it's in our space and in our hands, how are we thoughtful in delivery every step of the way? Something that we discuss openly and that we're very mindful of. And so there's a Lakota word, wasagya. So it's like to strengthen, to wrap in red. So taking the concept of that term, the definition of that, what that looks like in our modern practices and our intake. And so we ordered like 2 star quotes that were all red star quotes, different patterns of red. So prior to ordering the star quotes, we just used red cloth. So we have to go pick up our star quotes. We were just teasing about it. Did you pick them up? I didn't pick them up. You picked them up. So someone's getting the star quotes this weekend. They're going to make it into the shelter. And so taking the concept of wrapping red around somebody, whether it's an achievement, whether it's recognizing some work that they've done, whether they're in an intake process or their trauma or terror. And we've done this several times in this past year. I'm entering about my second tenure here, year and a half here at White Buffalo Calf, and smudging them while we wrap this red around them. And although it's not our traditional 7 sacred ceremonies, because it came up today, it's a question, do you still practice, in what sense? And that's for individuals to determine. But as a modern day woman society, for us to be able to respond immediately with the elements, with the directions, with songs, with artifacts, with language, with asking the ancestors for help. You know, prayer it's the more accurate description to call on the ancestors for help. And what that looks like in our space here on site. And then again, out in the community, how do we deliver those services? In addition, our legal advocacy, our mental health liaison, identifying gaps and needs and wraparound coordinated care, referrals to other systems that are in place, all aspects of wellness, your mental, your physical, your emotional, your cultural, and then the sustainability aspects, which is your center. How do you move that forward? How do you be sustainable in those practices as an organization, as a society, as a unit? And so it is so powerful when our advocates and our staff and all the work that we do interact with those with our victims or our clients or our relatives. So that is one example of our cultural practices. Beyond, of course, immediate, our team was awesome, immediate CDC guidelines with the, painter's tape, signs, measuring it out. So when women get together, we can do anything. So, and of course, guys too, because, you know, we got to give a shout out to them too. So thank you, ladies, for inviting me. And I really, I can't wait to, again, connect with all the participants and the work that you guys do. Gail, when you told me when we got a visit on the phone before this, and you were telling me your background in Indian country, oh my gosh, I was just floored. I was so amazed and thankful, and I'm excited to be able. Another thing I'd like to share and touch on for all of us together is being able to share those leadership roles and positions and honoring and lifting up other people who are coming into leadership roles, lifting up other people who are making progress in their field or making progress across the board, because it can be difficult. In Indian countries, sometimes that can be a challenge. That can be a huge challenge that affects our success of our programs. And we can't let the systems that maybe didn't serve us so well, and we're still feeling the residual effects, and it's not all sorted out yet. We can't let those sorts of things affect service and delivery. So coming together, because I know that it is a challenge that's been shared and spoken upon. So I thought on this platform, definitely acknowledge it and what it looks like coming together. And I hope if you haven't been to South, please come. It's beautiful when all this clears up.
Thank you so much, Lindsay. I so appreciate, and I get goosebumps as you talk, because I feel the potential for the future for victims and survivors with what you're doing. One of the neat things that we had confirmed for us on the call on Monday is that the sage and sweetgrass and essential oils and different things that we use in the cultural ceremonies are covered by our VOCA grants, if we do have a VOCA grant through the state. So that was nice to have confirmed by our DPS Victim Services folks on Monday. Renee, you have been in contact with your own vibrant victim service program at Muskogee Creek. You're always in close contact with victim service providers there in North Dakota. Would you want to talk to us a little bit about some of the changes that they're all seeing during this time?
Sure. And like I said, I'm not doing direct victim services in my current position anymore, but once you're an advocate for life, right? I mean, that just becomes part of your everyday life. So in that regard, I've had numerous conversations with many of my warrior sisters in the field in terms of how to serve victims during the pandemic. And just the vast differences of the programs, you know, really makes it a struggle. And our women have had to become more creative more creative than they normally are in how to serve their victims. And as Lindsay stated, pandemics and diseases, that's not new in Indian country. And tribal leaders absolutely relied on the traditional values of protection of the relatives and the citizens by no movement of the camp. That's historically true. And many of our nations have exercised that inherent right to protect their people of their nations by closing businesses, closing their borders, setting up checkpoints, creating task forces within their nations to do what's best for their people. That's what any good leader does for their nation, right? So it's the same for Indian country. And our nations have leaders who guide us under, our traditional methods, under tribal codes, policy, law, even emergency resolutions have had to been, put into play. And a lot of our victim service providers have been instrumental in those task forces and having that voice for victims about how we can work around the protection of the community but still serve our victims. Not being able to respond to victims, not being able to conduct outreach, like the powwows and many people, many of our tribes, the ceremonies have been canceled. We're not able to, partake in our cultural ceremonies right now, which is how we heal. So that's an additional struggle, not only for our victims to overcome, but from our victim service providers who are dealing with that vicarious trauma. So there's been a lot of conversation. I've talked to friends in the BIA and the FBI, and they're going through the same thing. Even though they're not at the tribal level, they're at the federal level, they're struggling as well. Because they're vested in their communities and who they serve and their partners. I can speak from my tribe, the Muskogee Creek Nation. Sean Partridge is the family violence director there. And she said they were able to actually accomplish everything pretty much with their court via phone, fax, and email. And they had very limited in-person services in regards to like SANES, emergency food, basic needs. They were really having to put some instrumental social distancing. They had to limit their shelter numbers. They just had to. And that was taking a toll not only on the victims but on the advocates themselves, feeling like they can't do their best to serve people. They were very fortunate at Creek Nation that they had actually purchased laptops and docking stations years ago. So on March 23rd, they actually went, the tribe shut down and everybody went telework. So they just had minor hiccups in the administrative part until they could just kind of lay out the lay of the land of how they were going to operate. Fortunately, they have an extremely good working relationship with their Light Horse Tribal Police Department, and the tribal police really took on a large role in stepping in and stepping up for these victims and helping with protection orders. The courts continued their non-emergency hearings, although they've seen a huge decrease in the number of cases that were coming through tribal court. A little bit different at Standing Rock. Casey Starr, who's the DV assistant advocate who works in tribal court, there's, housing's a problem in Indian country, so there's not a lot of housing, so a lot of the employees live off res. And again, we've got checkpoints and, you've got border security now, and you had to be really careful going on the res and off the res not to, bring things in and out. So a lot of people live near the hot spots of the urban cities of Bismarck or Mandan. And the tribe was doing what they thought was best to protect the community and implemented a stay-at-home order. So those who lived off res had to figure out a way to telework and still serve people, in the community. And that was really difficult. And it was extremely difficult. Casey said she really struggled because, you're working with victims all the time, and that one-on-one contact kind of had to stop and went to telephonic, and it's just not the same. And she could tell she was losing, that support mechanism with her victims because she couldn't be there with them. Victims were actually having to go to the court and file protection orders themselves. And luckily, she has a really good working relationship with her judge. So, and that was the other problem. They had an on-call judge, so he wasn't always able to be there. somebody that was close. So they were having, scheduling problems. And that took a while to work those hiccups out in order to give those victims at least the autonomy to make that decision on their own. And they had to navigate the court system on their own and how to do protection orders. So that was extremely hard for her. That was like one of the hardest things she said she had to overcome. And she actually started going back in 1 to 3 days a week, I think now, back into the office. And she's beside herself. And again, we're having that, we can't access our ceremonies right now for that healing that's so needed. And, it's, none of these victims should have to walk this journey alone. And it's really hard on the advocates that are having to try to navigate this and not really be there to help them. I know a lot of the tribes' offices are still closed at many of the nations to the public, even though employees are coming back. So that, again, is we're having to rethink, how are we going to serve victims if we can't allow, the public in, but we're coming back in. I'm Jean Bellegarde, who's the director at Spirit Lake. She's an elder. And she has some elder advocates. So they had their own, struggles of how they were going to serve and maintain their safety and health. And not to mention, she was very upfront about, internet and computer problems. I'm not a techie, so when I have to work from home and there's IT issues, if my IT guy is not available or accessible because he's helping everybody else, I'm pretty much in limbo, and working from my phone. So she had, she spoke to that they had a lot of technical issues, challenges they had to overcome. Sadie Youngbird, who's the director for the 3 affiliated tribes victim services here on Fort Berthold, where I am now. They kept their shelter up and running, and she was one of the few programs that I think they actually had an increase in domestic violence clients. She was one of the few that I've talked to, and I think people were just trying to be conscious. Again, housing is a huge barrier in Indian country, and we know that we have we have multi-families in our houses, right? So I think some victims were being cognizant of their elder relatives, and this was the time for them to get out and seek shelter and also protect their grandma or, somebody. So they saw that increase and implemented the best strategy they could for safety and hygiene and social distancing. But still provided shelter and direct services. And they worked also very closely with their law enforcement department and their court. And they struggled a lot in the beginning because they did have a COVID outbreak in the court. So that was problematic because it was like, we can't do anything because we don't know what to do right now. And they have a really strong task force here, a COVID task force. So they, immediately jumped into action and utilized a former domestic violence judge to handle protection orders. And their advocates are still on call, and that was absolutely voluntary. That she was like, whoever wants to volunteer to be on call, because I'm not going to force anybody to be on call. She was going to do it herself if she had to. So, she just had to collectively decide what was the best service for their people. So those are just some examples of how, tribes generally have the least amount of, when it comes to victim services, funding and resources, but they get super creative. And, there's something about Indian country advocates. There's no stronger force, I think, especially in communication. We all know each other and we all know everything, right? And we don't have any problem sharing that information. So my daddy's always said, you can telephone, telegraph, tele-Indian, and we will let each other know. That's our best, that's our best mechanism of communicating, is that we do communicate. So it was, I was really privileged that I got to have these conversations with all of my, sister warriors out there in the field. And I'm so grateful and appreciative and always in awe of their resilience and how they, no matter how hard it is, you keep going because they're advocates when it comes down to it. Like I said, once an advocate, always an advocate. You don't ever stop.
Thank you, Renee. Renee and Lindsay, both very powerful and rich information. While our helpers are getting ready to help us with some questions and answer, we will try to answer. I want to go back to Lindsay and see, Lindsay, if you have anything else you want to add before we go to the Q&A session.
Absolutely. Reflecting on the good relationships that have been built, that thankfully have been built with the staff and the advocates here, and following what that looks like to continue to provide services with the court. When you brought that up, that was really tough. And truly, when you mentioned also how it's affecting advocates to not being able to provide that services, oh my goodness, that was really, that's a tough one. And what does that look like coming back now? Because now COVID is just here, and so it's conflicting about, you know, and it changes every day, but advocates are still here, and coordinators are still here, and specialists, and everybody's still here, pushing forward with the programming at lightning speed. And what does that look like? And we have some really good cultural ideas, some SOF self-care stuff. So I hope to be able to share that with different programs out there that our teams have been developing, and what that looks like. But having, being able to come from a service perspective, no matter what your position or level is, maybe get together as a team and reach out to your state representatives and your people to advocate for a particular need, not on one side of a decision or other, but what specifically can they help you with to not be scared to do that.
Thank you, Lindsay. Deidre or Danae, I'm going to ask that you access the questions for us, and then we will try to answer those.
Sounds good. So this is Danae, and one of the questions is, what are you seeing regarding elder abuse, and how is it being handled now?
That's an excellent question. Lindsay, what are you seeing? And then Renee will come to you.
Elders, along with Q community and MMIW are our gaps, right? For White Buffalo CAP, that's what we've seen over and over and over, our gaps. So services to elders, again, I think is in this state that we're in, increasing because we're able to get the services to them, because it is difficult for elders to transportation, to even be able to mobile, to have access to their own resources sometimes. And so that is a very, very marginalized population, very special population. And so getting into our remote communities, turning it back to those Tioshbai systems where advocates can be right there, maybe even a community that they're from, hopefully, and be able to be advocate and be there present, turning the services back to the elders, and then advocating to them, to the different services, which White Buffalo CAF, the team has a really good, their resource connection amazes me every day whenever we go over cases and what that looks like in wraparound and coordinated care, and the hours that they put into it. You know, at this time, our remote advocacy work, we have hours on the phone anyway, coordinating that care. And so it works for them while they're able to take care of their families and be safe. But that is a gap that I definitely see, is, as we all know and can recognize and acknowledge in our communities, of what that service looks like on site. We have accommodated for them as far as any handicap access, where we're going to put individuals with their different either quarantining in this, you know, in certain cases, or underlying conditions, and what that looks like and what we can provide to them as service. We have, as y'all have mentioned, elderly advocates like our unchis, our grandmas, and one of them has been here 20 years, off and on 20 years at the organization. And she's an amazing woman with vast knowledge in the history of many aspects. And the service that they provided, some of their programming stuff, they would be cooking and doing wellness. they would be sewing and doing wellness with other programming aspects. And so when our staff, our advocates, is really diverse as far as their age and their communities, and we even have some neighboring tribes over here. We have a non-native, she's sitting right here across the desk, working away on numbers, making the office flow. And so we all come together. But when our elders come in, when we're able to connect with them, when I feel our elder advocates have a special place, and of course they're going to might even know each other, might be relatives, who, whatever that looks like. As we know from our communities, it sometimes doesn't take much to find out a relative or relation, but always in a respectful way. And in fact, that is a very good thing in our work that we do, that I found more often than not, that it lends to the South, that it lends to the situation. So providing those specific needs and aspects for elders, and of course tying them into the resources. What does that look like to get them out at the 20plex out here for the community, and getting the application and everything logged into them. So, but they are a very underserved gap in our service.
Thank you, Lindsay. Renee?
I can speak a little bit about what they're doing here at Fort Berthold. I know that, and my tribe also, at Muskogee Creek, that since we know that elders are high risk, they have really made sure to implement that in the task forces, that what can we do? And so there's a lot of service delivery, food, just basic needs and necessities that elders need. They've got people that are coordinating, in different communities. Here they actually have these signs hung up in their windows, like, hey, I'm okay. It's green if I'm okay, yellow if I might need supplies, whether that be groceries or just whatever, and red is I need help. And they have somebody that drives through each segment in the communities several times a day through the night, checking on the elders. I thought that was ingenious. So, and that's what the task force came up with. As far as serving the elder abuse, unfortunately, not unfortunately, I don't mean it that way, but our elder abuse programs are ran usually by elders, and they're at high risk right now. So that has been a challenge. And the people that I've talked to have not seen an increase, but what we're afraid of, with just like all the other forms of abuse, it's happening and we're not hearing about it. So when we can get back to some kind of normal, we're afraid we're going to see a huge increase in that, unfortunately.
I love the ingenious idea of the red, yellow, and green messaging in the window. That's awesome. Danae, what's our next question?
Have you moved into any type of texting or chat services during this pandemic? If so, do you see that continuing?
It's a great question. Lindsay, have you all moved into those areas?
We are looking into getting our advocates developed. We can never have enough training. They're doing some phenomenal stuff all across the board, all areas of wellness, all areas of where we deliver services, whether it's direct service, indirect, in and out of shelter. We have gotten, now logistically, pretty much every advocate has a phone. What does that look like in their training? We want a really well-trained staff, so we need our script, and DVPI is currently working on what that looks like. We had some really good momentum right before all of, in March hit. And so continuing to look at what was developed and providing that to staff. And then logistically, what are the systems for privacy? What does that look like at home when they're responding, and having those sort of discussions. And then, yes, I do absolutely feel free. Myself as a survivor, there were times when I would reach out on calls and texts and chat boxes daily for weeks at a time, to be able to get that support. And so knowing that our community needs that. And then the other end of this, how can we get emergency EFA in the form of a cell phone, of internet connection? What does that look like for them to be able to reach out, whether it's for programming or EFA or support, or advocacy when they're calling in, and what does that look like? So we're pretty secured here at the organization with our staff and the actual resources and the materials and the tools and the technology that they need. now we're at the point to implementing a script that's been developed, a call log, a process at lightning speed. Really proud of the team. And what does that look like as far as the exact platform? That's probably our next step here. Myself and the victim service, the shelter director, we'll be having that discussion as we look towards advocates, because we're still not coming back. This is going to be here a while. We're still not coming back. And also in our systems and how we're here and on site and in the field and at home, continuing that might actually work better for us. Our policies that look like for us, for our staff and our advocates to be able to have that praxis, that powerful space, as we all know, be able to multitask and be able to have some on-site and off-site work. And what does that look like in the shift of the community and our services? So those are some interesting things that I think would lend well to, as you're saying, the texting and the email, and the different technology that's out there. So I definitely want to implement that. I know Strong Hearts is, their helpline is amazing for that. And I know we've had conversations and different administration has reached out, and the toolkit on there and the available resources and what that looks like, and always tailoring it to your community, your language, what that looks like, and what works, because we know what works in our communities in Indian country. We can create and define our own success. I still believe absolutely within these systems and how we interpret them, how they in the organization and on the ground, and with the tribal programs and the very, very vast service area that we work in, whether it's urban or rural. What does that look like in for our tribal people?
I want to go back to you again, Renee, before we close, excuse me, and give you a chance to, if there's anything else that you didn't add before that you would like to share, and then we'll see if we've got time for any more questions.
I don't think I really have anything else. I just want to reiterate that, there's people are asking like questions about different types of victims. And, a lot of our programs, that's one of the things about Indian country, because of their funding, they're restricted a lot on who they can serve and how they can serve. So, we need to keep that in mind too when you're working, if you're developing a program, if you're applying for funding. I say throw everything in the kitchen sink that you can, and let them tell you no, because that's how in the movement, that we've been involved in so long for funding for Indian country. That's how we've made progress, with the great voices of the ladies before us. But I don't think this is specific to like just DV or sexual assault victims. I think this is where we're at now with all victim services, and it's going to look different, like Lindsay said, in every community. We define our own successes. We define our own terms of what's best to serve our victims. So whether it be elders, whether it be our relatives with disabilities, it's going to be different everywhere. So that is one of the purposes of the tribal resource tool is, even if you can't find a specific service in your area, there's going to be programs there. And like I said, there's nothing stronger than the advocate, communication train. So you get on there and you can call one person, and I guarantee you they're going to know some people that can help you. So there's a lot of really good programs in the tribal resource tool that may be in your area that can help answer these questions more specifically respective to your location.
I know we're close on time. Do we have several more questions, Danae? Something that maybe we could answer and provide the answers to whenever we send out the link to the recording?
We do have a couple more questions. There's one question that I would actually like to ask, simply because I think that the answer might be very helpful to a lot of folks. And that is, what advice or guidance do you have for advocates who provide services in their own community where they will most likely know the survivor or victim and or the suspect or defendant? A lot of the times there aren't enough advocates to hand off to, and when we are relatives, how do we work those relationships off ours?
That's such a good question. Lindsay, I'm going to go to you first, and then Renee, I'll come back to you.
That's a really good question. I believe that it's, of course, the relative's comfort level. More often than not, they'll express it. If not, maybe they're unaware, or over time, they will share with an advocate. So their comfort level is priority number one. And what does that look like in direct services with the advocate? If we can, of course, the ideal is to always strengthen and protect. Aswagia na awayanke. How can we turn back in to use that, which we have on many levels at White Buffalo CAF? How can we ship systems to strengthen the organization and delivery services? In fact, that's our go-to. But that's our go-to. And so, if the relative's comfort level is there, then how do we support that? And that becomes very, very powerful. And it leads to a connection to the organization itself, a connection to healing and the processes, and being more open to the other programming and support we have at White Buffalo CAF to funnel through that powerful point of contact, that auntie, sister, grandma role. Those kinship roles are really powerful, and using those as a form of advocacy. If the comfort level is not there, then immediately addressing how does the relative see themselves being more comfortable, and how can we accommodate, and then eventually having the conversation about what it looks like to heal and move forward, and how can we rectify if there is mistrust or discomfort. If we can, then what does that look like in a mediative sense? What does that look like in coming together and doing cultural practices and protocols? Because as those spaces, as a woman's society, that's part of our role too, is to create healing and unification ultimately through peace. And so what does that look like if those situations arise, which often they do, and we don't know how that's going to turn out, just as we don't know with any services that we provide how that's going to eventually resonate within our individual relatives' life choices and the steps that they take to their own healing and wellness. We can only be there to support and mediate in a healthy way, in a way that's constructive, in a way that has shared leadership, but you balance with accountability as well. So providing those services is so unique, even to beyond just Indian country, right? But to your individual organizations, family, society. So turning back to Tioshpe is sort of always the go-to, I feel.
And one thing I might add on that question is, if you have a trusted system advocate like a state or federal victim specialist that you work comfortably with, that might be an option in this situation if, as Lindsay said, the victim's comfort level is primary. And if they are comfortable with that relationship, it might be an opportunity to work in concert with one of your system victim specialists in that, to answer that particular question. We are at time. I want to respect everyone's time. I want to say, though, take the time to say that what every one of you do is so important to victims and survivors. We pray that information we've shared today is helpful to you in some way. You have our contact information. You'll have it in the follow-up email. And we just want to be supportive to you in whatever way that we can at NCVC and at White Buffalo CAF Women's Society. So thank you so much for honoring us with your time on this webinar today. Be sure and put your program in Tribal Resource Tool if you haven't done so yet, and take a look at it online and use it in serving your victims and survivors. And Renee Williams, I'll hand it back over to you.
Yeah, I just want to say thank you all for joining us, Gail, Renee, and Lindsay. We are so lucky to have you on our team. We continue to update our Facebook page, which everyone can find by searching on Facebook. It'll be under Crime Victims Community and COVID-19 Keep an eye on that page for updates and upcoming webinars. And if you'd like to suggest an idea for a future webinar, please contact us there. We are more than open. But thank you everyone for joining us. And again, thank you, Gail, Renee, and Lindsay.
Thank you. Bye-bye.
Thank you, Dr.